Hello, I'm Dr. McCardle from Valley Immediate Care. You've tested positive for COVID-19. I'm going to share some important information with you about your illness, and you'll receive a brief handout that you can read at home. COVID can be contagious for 10 days after symptoms started. You'll want to isolate yourself at home for at least 5 days. Isolation means to stay in a separate bedroom, use a separate bathroom, and use a mask at home if you must leave your bedroom. Don't go to work or to school or the store. Stay home unless you need emergency care. You're trying to prevent the spread to others. After 5 days of isolation, you may leave home. If your symptoms have improved and you're not having a fever for over 24 hours, but you should wear a well-fitting mask at all times for the next 5 days to prevent that spread. Remember, you must isolate for 5 days and until your symptoms have improved. If you still have a fever or feel very sick, continue to isolate. If you're positive but have no symptoms, isolation starts the day you test positive. Please notify all the people that may have been exposed to you from 2 days before your symptoms started. Tell them you have COVID and that if they're not up to date on their COVID vaccine, they should quarantine for at least 5 days. Up to date means having had a booster or it's been less than 6 months since their original vaccine shot. If they do not develop symptoms during those 5 days in quarantine, they can leave quarantine but should continue to wear a mask when around other people for at least 5 more days. They may want to get a test on day 5 to make sure they don't have asymptomatic COVID. If they do develop any symptoms, they should get tested and isolate. You should contact your employer or school and tell them you have COVID and you will not return until you're no longer contagious. Many people ask what to do about the symptoms. You can use medications such as Tylenol, ibuprofen, or other over-the-counter medications as needed. They may help ease your symptoms a little. You may want to get a finger pulse oximeter at the store or online to make sure your oxygen level stays in the safe range, above 90. If you do develop significant shortness of breath, difficulty breathing, or confusion, you may need further medical care. If your symptoms are severe, go to the ER or call 911. Tell them you have COVID before you arrive. New treatments for COVID are being developed. People with diabetes, heart disease, lung disease, kidney problems, increased body weight, active cancer, pregnancy, or immunosuppression may be at higher risk for complications and hospitalizations. If you are in this high-risk group, consider asking one of our providers if you qualify for any of the treatments that may be available, including monoclonal antibodies and pill forms of antiviral medications. If you need to be re-seen at Valley, please make an appointment online or contact your primary care provider. Be sure to tell them you have COVID. People often ask about returning to work or school after COVID isolation. If you've had COVID, you do not need and should not get a repeat test for COVID. You just need to complete that isolation period and then continue using a well-fitting mask for at least 5 days afterwards. This virus keeps changing. Our best defense is to get everybody vaccinated and boosted, even if you had COVID. We care about you, we care about this community. We'll get through this together. Continue to mask up. Take care.